So we are here on a consultative forum where we bring up the various programs that have to do with children, most importantly HIV and tuberculosis. And we found out that a lot of our children are getting infected and they are dying of tuberculosis and also HIV. So we are here to brainstorm, bring in every stakeholder to find, to have an understanding on how we can move it forward towards rescuing the children.
And today we have a consultation on TB HIV as it relates to pediatrics, to children. In Nigeria, as of today, we already know that we've had a lot of progress. We've made a lot of progress in terms of the HIV response. For adults, we've almost reached the goals of 95, 95, 95. We're pushing very close to it. But for children, we're still behind, and that is really the background against which today's consultation is taking place. As of today, we have about 88,000 children on HIV treatment, and we're pushing to reach 150,000 based on the estimates that we have. And in order to do that, we've made some efforts on the health sector side. For example, we have a national acceleration plan which runs from 2020 to 2022. But this is like a midpoint of that plan. And so this gives us an opportunity to look again at what we have tried to do and what we need to do to get to our targets and ensure that we indeed accelerate progress, and we can identify additional strategies, looking at what is working, what we need to do different so that we can achieve the targets, ensuring of course that we do not leave children behind. That is really critical as we move towards achieving epidemic control.
And we are thinking that at this moment we should be able to galvanize and come up with a robust plan towards kicking out tuberculosis and HIV or AIDS as it concerns children. Already, I'll talk about the National Tuberculosis Program. We are struggling with a funding gap of 70%. So 23% comes from the implementing partners being supported from external donors and 7% from the government. So we are opening up avenues to bring every person on board to find a way of improving the funding for kicking out tuberculosis in the country, especially amongst the children. Now, you may be surprised, you may ask the question, why the children? We found that diagnosis among the children is very difficult because, like in adults, we tell them to cough, they can bring out the sputum, but in children it's difficult to assess the sputum, they'll swallow it. So we have come up with other mechanisms of taking samples to ensuring that we get on time in the diagnosis of tuberculosis among the children. And I think I want to use this opportunity to let people know that the two major issues stand out. The number one is malnutrition, and the other one is HIV or AIDS. So we're also opening up, engaging others to, especially the reproductive maternal and newborn child, making sure we get to the communities, to child welfare clinics. And our assumption is that any child we see with failure to thrive, with malnutrition, we quickly take the stool and send it to GeneXpert, which is a diagnostic platform. And in most of the cases, we've been able to diagnose the tuberculosis on time for effective treatment to cut the chain of transmission.